Hi, I'm Dr. Doug Ehrenberg, and I specialize in pulmonary and critical care medicine. One of my particular areas of interest is in the prevention of lung cancer, and nothing is more effective in that than helping people stop smoking. As a medical assistant, you play a very important role in the care of patients at Michigan Medicine, and when it comes to tobacco assessment and treatment, your role is truly essential. You see, every patient has a chain of contact between themselves and our health system. Medical assistants are often the first link in that chain. The next link is usually the physician or other provider, whose job it is to assess a patient's readiness to quit and provide help to those making an attempt. The final link is the clinic nurse, who provides follow-up care, medication refills, and answers questions often long after the visit has been completed. This chain of contact is crucial in helping people stop smoking. When you consider everything that we as healthcare professionals can do for our patient, there's virtually nothing that has the potential impact of helping smokers quit. In order to help our patients reach this goal, physicians and other providers must have accurate and up-to-date information on the patient's tobacco use. And that's where you come in. There are 3 key pieces of information that need to be reported. The first is, has the patient ever smoked? For current or former smokers, the second piece is for how long and how much have they smoked. This is typically measured in pack years. And the third is, if they've quit, how long ago did they stop smoking for good? The good news is that this information can be obtained and recorded with relatively little effort. If you look at the current pull-down menu when taking a tobacco history, there are 9 options. This is overly complicated, and for adults, we really only want to select between 3. Are you a current, former, or never smoker? Don't worry about light versus heavy, someday versus everyday. These categories are not well defined, and they aren't very helpful when it comes to identifying those who need help quitting. When entering the tobacco exposure information, if someone is a never smoker, that's pretty easy. You simply enter it and move on. However, when somebody is a current or former smoker, we want to know 2 things. How long have they smoked, and on average, how many packs per day? When it comes to how long they've smoked, it's okay if you round up or round down. For example, if they say they can't remember if they smoked for 37 or 40 years, you can enter 35 or 40. In terms of packs per day, the easiest way to get this information is to ask the patient, on average, how long does a pack last you? They'll likely respond in just the right way. For example, they may say, I smoke a pack a day, or I smoke a half a pack per day. You then enter this information into the blank provided. This gives us an idea of the intensity of nicotine dependence, as well as helping us target those who might be eligible for lung cancer screening. For anyone who's a former smoker, please take this opportunity to congratulate them, and then follow up by asking, how long has it been since your last cigarette? We don't need to know a precise date, just whether they quit days, weeks, months, or years ago. Why is this important? Because often patients quit just before going to the doctor, especially if they're going for a smoking-related problem. If someone quit recently, say within the last 6 months, their risk of relapse is very high. But this is also a tremendous opportunity for an intervention that can help them improve their success rate. Sometimes you'll be meeting with patients who return to the clinic after they've previously had their smoking history recorded, and many patients will report that they're cutting down. This is great news, and they should be congratulated. The information should definitely be added to the chart, but the pack years recorded for this patient should not be changed to reflect the reduced number of cigarettes used per day, as it may lead people to assume a lower total pack year exposure. That is to say, you can't unsmoke 50 years worth of cigarettes. Remember, the purpose of this information is to inform the physicians of the degree of cigarette smoke exposure over the patient's lifespan. The best place to record this information is in the comments section in the substance use history, making a note, for example, that the patient has cut down to 5 cigarettes per day. For people who have quit, it's important to remain vigilant for relapses. We should continue to congratulate former smokers who return to the clinic, but ask if they've had any relapses. We must do this in a way that's not judgmental, and that keeps the door open for you and the physician to encourage them to make their next quit attempt. Remember, relapses are the rule, not the exception for people who have quit within the last few years. Finally, one last word about assessing smoking in our patients. Tobacco ravages people's health, and we often blame the patient for their dependence. But I cannot emphasize this enough. Stigma and shame have absolutely no place in the exam room. When interacting with anyone who has a substance abuse disorder, in this case tobacco users, we must show empathy and encouragement as much as possible. We want our patients who smoke to know that we're on their side. When they feel supported, they're more likely to accept our help. So thank you for both your compassion and your attention to detail as you work with your patients. As we emphasized in the beginning, medical assistants are the first link in the chain of contact. Your local workflow may differ from what I've described here, but the same principles apply no matter where you work. So embrace the roles defined for you by your clinic supervisors. But remember, how you record tobacco use history can have an important effect on how we care for our patients. The stronger you are in your role, the stronger the whole chain will be, and the greater impact we can have as a health system in helping our patients battle nicotine dependence.